Senior Research Analyst, Access Alliance, Decent Work, and Health Network. Morning. You have 5 minutes whenever you're ready.
Okay. Good morning, council members, and thank you for this opportunity. I'm an assistant professor at the Dalanan School of Public Health, and I work as a senior research scientist at a community health center in Toronto called Access Alliance. I'm here today to speak on behalf of the Decent Work and Health Network. The Decent Work and Health Network is made up of healthcare workers, doctors, nurses, health promoters, occupational therapists, etc., who are deeply concerned about the rise of precarious, low-wage jobs in Canada and how this is impacting our health and our healthcare system. For the last 10 years, we've been conducting research and synthesizing evidence from around the world on how job security, job quality impacts health. Based on this, we can tell you that there is an overwhelming body of evidence from Canada and globally that precarious jobs are resulting in seriously damaging impacts on the health of hardworking families. Compared to workers in stable jobs with benefits, precarious workers are 2 to 3 times more likely to incur fatal occupational injuries at work. They're also at much higher risk for developing a host of illnesses, including ulcers, musculoskeletal disorders, migraine headaches, asthma, depression, anxiety, sleep disorders, as well as serious chronic health issues like heart disease, diabetes, and cancers. The evidence on this could not be stronger. Precarious jobs combined with low wage constitute the most critical determinant of health. The most telling evidence on this actually comes from UK-based research called the Whitehall Studies that followed 28,000 government employees over several decades. Thus, we are joining voices with QP Local 79 and many other organizations in recommending to City Council to introduce bold policy solutions and safeguard measures to stop the rise of precarious jobs in Toronto, starting with its own workforce. As an essential step, we call on this committee and the council to first develop and implement the job quality assessment tool before making any major decisions to contract out services, particularly services like cleaning that tend to experience sharp decline in job security, wages, and employee well-being when contracted out. If we fail to do this, we'll add fuel to the vicious race to the bottom trend in Toronto. Yes, Toronto is the richest city in Canada, accounting for 11% of Canada's GDP, and yet this city holds the unfortunate title of being the child poverty capital, the working poverty capital, the precarious job capital, and the most unequal city in Canada. Nothing could be more sad and ironic. And these are the stats that keep me up, and I reviewed the stats last night, so it really kept me up. Studies show that more than half of the jobs in Toronto and surrounding regions are precarious and insecure. Government and nonprofit sector are among the worst contributors to this rise in precarious and low-wage jobs. During the last couple of years, there's been a marked increase in outsourcing of cleaning and custodial jobs. Immigrant and racialized women tend to be overrepresented in this sector. The City of Toronto's own staff report from 2013 documented how outsourcing of cleaning services in other cities led to decline in wage, job security, and workers' health. In another study with outsourced hospital cleaners and support workers in BC, 1/3 reported having to work more than two or three jobs just to make ends meet, and 63% reporting getting sick or injured in their current job. Any short-term savings from outsourcing and reducing wage and job security, we end up paying heavily through downstream social costs and with our health. For example, analysis by the Canadian Council for Policy Alternatives found that cleaners working in the private sector are 4 times more likely to access social assistance than those working in the public sector. If we outsource cities' cleaning jobs, especially without implementing the job quality assessment tool, we will be directly responsible for putting workers at higher risk for numerous health issues, including workplace injuries, heart disease, diabetes, and cancer. Further, it'll worsen the already higher rates of gender wage gap and racialized poverty in Toronto, making this city even more unequal. We need to work together to stop this from happening. we strongly recommend that the City Council prioritize the development and implementation of the Job Quality Assessment Tool. The Job Quality Assessment Tool needs to include provisions for assessing and promoting living wage, job security, regular and reliable hours, workers' safety and training, paid sick days, and other benefits for both in-house and outsourced jobs for the city. Moreover, the decisions you have in front of you is more profound. It is about what kind of city and what kind of society we want to create. Do you want to go with the flow in terms of outsourcing and precarious jobs to save short-term costs,
Excuse me, sir, if you wrap up, please.
in spite of evidence that this will make Torontonians very sick? Or do you want to boldly challenge these powerful forces to create a make City of Toronto a city of good jobs and healthy workforce? Thank you.
Thank you. Are there any questions of the deputant? Seeing none? Okay. Thank you very much for coming in this morning.